I am now recording. You're going to do great. Just take a deep breath and start rolling, okay? I will hit the stopwatch on your first word of your presentation.
Hello, my name is Drew Patel, and today I'll be speaking to you about the crisis that our healthcare is going through. Before I get started, I have a question for you. How many of you guys have been sick in the past? Oh, raise your hand or give me a thumbs up. Oh, all of you. Imagine being sick without a cure or antibiotic to alleviate it. This issue is becoming larger due to the increasing number of antibiotic-resistant bacteria. Before getting into antibiotic-resistant bacteria in the United States, the use of antibiotics is important due to its global occurrence. Many countries are dealing with this issue, such as Brazil, which also need help with their biosecurity. Biosecurity is a procedures that are intended to protect humans or animals against disease or harmful biological agents. The president of National Biosafety Association of Brazil states that many of the infectious outbreaks are due to the human error in laboratories. For example, according to the Journal of Health, Education, Research and Development, 2 teams of scientists in Brazil modified H5N1 viruses that are capable of airborne transmission in ferrets. The president of ANBio states that by raising awareness and adding global guidance in laboratories, we can reduce infectious outbreaks. Due to the undeniable fact that human error is going to occur, this leads to an issue in the United States. That's going to be how to combat one, especially if one is an antibiotic-resistant one. This creates the question, #resistance. How can we save our healthcare? The common solution to the issue is creating new antibiotics with new ingredients. The issue with antibiotics is that as time goes on, the number of working antibiotics is reducing due to antibiotic-resistant bacteria. The number of antibiotic-resistant bacteria is only increasing, and the common solution is to create more antibiotics that these bacteria are not immune to. For example, there have been an increasing number of bacteria that have been found that are resistant to carbapenem, which is one of the most common and highly effective antibiotic agents. According to Statista, by 2050, the number of deaths by antibiotic-resistant bacteria are projected to increase and take over the amount of people that die of cancer. A study conducted by the Center of Infectious Disease and Disease Research and Policy states that the number of bacterial infections in the United States that were antibiotic resistant doubled from 5.2 to 11% in the years 2002 and 2014, and the numbers have only increased since. As of December of 2019, there was only 41 new antibiotics that had the potential to treat serious bacterial infections. To combat antibiotic resistance, the government needs to invest $2 billion on top of the 1.2 that has already been invested. This is to allow for the increase in researchers and production without the worry of being able to profit off the antibiotic that is created. This would allow for research laboratories to create economic incentives for the researchers. Another example, beta-lactamase is an enzyme produced by bacteria that provides resistance to antibiotics, such as penicillin. From the years 1970 to 2010, the number of unique enzymes that were found from beta-lactamase increased from 1 to 900. This is just an example of one type of antibiotic-resistant bacteria that has grown from its first form. To stop beta-lactamase from increasing, there are inhibitors that can be purchased for a price ranging from $1 to $400 per inhibitor that is only good for one use. Researchers are also producing different forms of medicine such as penicillin that is modified with different ingredients to combat the beta-lactamase resisting the antibiotic that is created. This creates a larger bill to be paid due to the different medicines that are needed. Another study conducted by the Center of Infectious Research, Disease and Policy also stated that antibiotic resistance adds $1,400 to the medical bill. Due to its high cost, many new antibiotics are not being created due to the fear of that. Creators will not profit from the creation of the antibiotic and may even lose money that is invested into it. According to the CDC, the number of antibiotics that are being developed has increased through the years. With the money that the government has provided, there can be an economic incentive. Economic incentives allow for the researchers and developers of new antibiotics to have a large motivation to create new antibiotics. For example, if there was a reward for the group of developers or researchers to create the new antibiotic, then the pace in which the antibiotic is created will be quicker. This will allow for a large increase in production rate and new antibiotic without the fear of losing money in the creation of them. With economic incentives, there can also be an addition of disincentives. These are for when there is a large waste of product during the production of new antibiotics. Putting disincentives would minimize the waste of products during the production of the new antibiotic due to the fear of having to pay for the loss of the product. This would only increase the efficiency of how much it used during the creation of the new antibiotic. With only 41 new antibiotics having the potential of being released in December of 2019, this would increase in developers and researchers. Overall, to stop the increasing rate of antibiotic-resistant bacteria, there needs to be an investment from the government to help create antibiotics to replace the ones that do not work in the bacteria. This would allow for more researchers and developers, ultimately increasing speeds. And if the government of the United States of America is willing to invest another $2 billion, then the production of new antibiotics will increase and the amount of antibiotic resistant will decrease. This will also allow for the price of medical bills to drop. And that's it.
Oh, fantastic. Woo!
I forgot to.
I stopped your time. Let me stop the recording. Oh, you're going to do great. I have now started the recording back. So I'm going to turn it over to you. The floor is yours, Madison.
Hello and good morning. My name is Madison Steddard, and today I will be discussing a serious threat to public health and a solution I believe can save global healthcare. To start, how many of you have received an antibiotic this year? Well, according to this graphic by the Center for Disease Control, the CDC, an estimated 80 to 90% of all antibiotics prescribed in the United States are in the outpatient setting. Up to 50% of these prescriptions are unnecessary. Mississippi and other southern states have the highest prescribing rates. In the US, inappropriate antibiotic use accounts for an estimated 2 million antibiotic-resistant related illnesses, 23,000 deaths, and $30 billion in healthcare expenses each year. However, this is not just a problem merely in the US. In the European Union, antibiotic resistance accounts for 25,000 deaths per year and 2.5 million extra hospital days. In India, over 58,000 babies died in 1 year as a result from an infection from an antibiotic-resistant bacterium usually passed on from their mothers. Overcoming this issue of antibiotic resistance would not only help alleviate hospital bed shortages and save billions of dollars, but also save the lives of people globally. Antibiotic resistance affects anyone of any age in any country and is a pressing problem that needs a solution. There are several ideas about how to approach this issue. However, today I will be talking to you about using CRISPR-Cas antibiotics to save our healthcare system and the lives of thousands. For several years, doctors have treated common bacterial and viral infections with simple therapies and medicines. If you were to come down with a sinus infection or a stomach virus, you would likely be prescribed a broad-spectrum antibiotic that would clear out many types of bacteria. The problem with this method is that microorganisms evolve quickly, and many develop a defense against medicines meant to attack and suspend their replication. By 2050, drug-resistant pathogens are predicted to cause roughly 10 million global fatalities per year. This is more lives than are currently taken by cancer, traffic accidents, or diabetes. Looking at these predictions, it is clear humanity requires something to fight these resistant bacteria. As a result, scientists are turning to CRISPR-Cas9. CRISPR is the acronym for Clustered Irregular Interspaced Short Palindromic Repeats. In its trial phases, CRISPR has been used to alter mosquito DNA to prevent the spread of malaria, change the genetic coding of tomatoes to have more flavor, and rewrite human DNA to prevent genetic illnesses such as diabetes. Currently, the possibility of an antibiotic using CRISPR is being explored. The genetic editing tool, in its natural state, protects bacteria against viruses. Right now, it could be the innovative way of fighting antibiotic resistance. The elusive gene that makes pathogens drug resistant can easily be detected thanks to a test from CRISPR-Cas9 gene editing tool. CRISPR can target antibiotic-resistant genes in the pathogens and cut them from their genetic code. Using the powerful gene editor, scientists have reported the development of a gene-driven drive system that is 100 times as effective as other modern methods of inactivating a specific bacterial gene code responsible for making bacteriums drug-resistant. CRISPR has the advantage because, unlike antibiotic treatments, CRISPR has a unique ability to be modified as needed. Cameron Mybold, a postdoctoral researcher at Broad, said, quote, "If a virus evolves and mutates, we can simply change the CRISPR system to match whatever the virus is doing," end quote. The best analogy to describe the ability is to compare it to a pair of scissors, or even an Adobe Photoshop for genes. The adaptability and flexibility of CRISPR makes it the most efficient and ideal way to win the war against antibiotic resistance. Despite the ability of the tool, there are some ethical concerns regarding the use of CRISPR as a next step in antibiotic. Genetic editing has received a negative connotation due to mainstream media, cinematic productions, and religious beliefs. The general public fears the idea of editing human gene coding, whether it be due to moral opinion or their own well-being. However, in the medical setting, CRISPR is mainly used to alter the genetic coding, or the bacterial coding, not whether or not a person has blue eyes. Ethical considerations such as safety, justice, and equity have been debunked. Many of the concerns regarding CRISPR are raised from the incorrect assumption that it will only be available for the higher class. In actuality, CRISPR offers a quicker and more cost-efficient trip to the doctors and prevents further hospital visits, saving patients thousands. Dr. Bargo, a microbiologist at North Carolina State University, believes that once CRISPR is shown as effective in humans and animals, it'll be cheaper than conventional therapies. Genetic editing has been researched for almost 40 years, with the biggest limitation currently being ethical. Society needs to understand that any medical innovation is going to have its concerns, but if we are to evolve, we must accept the new therapies as forms of treatment. The war against antibiotic resistance is currently a war we are losing, and CRISPR can help give back the upper hand. Conclusively, I believe all evidence points to CRISPR-Cas9 as being the next scientific miracle worldwide. Although future research is required to understand all the risks associated with the science of gene editing, CRISPR could be the critical step in the right direction. Starting with CRISPR as a way to alter bacterial code offers a safe alternative to changing human DNA. However, the social challenges associated with the widespread use of CRISPR does require public engagement if we are to set up the appropriate guidelines for the technology. Once perfected, CRISPR can reform healthcare, making it more cost-effective and efficient. Despite some general questions and concerns regarding genetic editing, it is important to remember nothing in healthcare has ever been implemented without major scrutiny. I will leave you with this. When a scientist first suggested hand washing as a way to control disease and death, he was ridiculed and the idea was rejected by medical professionals. Today, in 2020, hand washing is saving lives. Thank you for listening.
Woohoo! Great job. Let me stop your clock. That was a well-structured argument. Let me hit the stop record. Eli, I know yours is so very well researched and you're going to do a fantastic job. The floor is yours and you are ready to begin.
Thank you. Hello and good morning. My name is Thomas Knoll. Antibiotics have been the saving grace of modern medicine, fighting even the worst of bacterial infections. This normal bacterium is simple and easy to kill because of antibiotics. But antibiotics are not perfect. Through evolutionary pressure, bacteria can develop a particular resistance to these antibiotics, effectively reducing our treatment capabilities against them. This superbug has become a nightmare and a reality. Entirely resistant to every drug we throw at it. Unlike the previous bacterium, it can kill us. It is this antibiotic resistance that has developed to become a pervasive issue in American healthcare settings, particularly due to the overuse and misuse of antibiotics, which provides an optimal environment for its occurrence. In their 2019 AR Threats Report, the CDC tallies the infectious extent of antibiotic resistance. More than 2.8 million antibiotic-resistant infections occur in the United States each year, and more than 35,000 people die as a result. This issue is not limited to the US, however. Every nation faces it. Antibiotic resistance spreads quickly and quietly, reaching nearly every corner of the globe. In their 2016 review, the UK Commissioned Review on Antimicrobial Resistance concluded that antimicrobial resistance results in an estimated 700,000 deaths globally each year, a number projected to reach 10 million by 2050. The threat of antibiotic-resistant bacteria is expected to spawn significant widespread implications regarding global biosecurity and resource allocation. In their 2017 economic report on the threat of drug-resistant infections, the World Bank Group estimates annual global losses from antibiotic resistance to reach as high as $6.1 trillion by 2050, resulting in an estimated 3.8% reduction to global GDP from 2017 to 2050, a reduction comparable to that of the 2008-2009 financial crisis. So how can we save healthcare? Better yet, how can we save humanity? Because of the advanced onset of antibiotic resistance, we should reach the root of the problem, the very use of antibiotics. Alternatives to antibiotics exist, namely bacteriophages, bacteria-specific viruses. These little viruses have the potential to kill this bacterium. What if we could harness these viruses to kill this nightmare bacterium? Fighting fire with fire. Ironic, right? Ultimately, however, it is through alternatives like this that we can effectively tackle antibiotic resistance. Bacteriophages in particular are superior to antibiotics in various aspects regarding safety, efficacy, capability, and value. Compared to antibiotic treatments, bacteriophages are relatively safe. As Catherine Lockerillo and Stephen T. Avedon detail in their 2011 journal article, Pros and Cons of Phage Therapy, bacteriophages have a low inherent toxicity due to being made up of organic molecules like nucleic acids and proteins. Additionally, due to their specificity towards particular bacteria, phages effectively reduce collateral damage to bacteria that are actually beneficial to us, because in our gut. This is in contrast with traditional broad-spectrum antibiotics, which effectively eliminate all bacteria, good and bad. As mentioned in a 2020 journal article titled How Phages Overcome the Challenges of Drug-Resistant Bacteria in Clinical Infections, bacteriophage therapy, unlike many antibiotic treatments, rarely results in any negative side effects. This is largely due to constant human exposure to phages in the environment. In a 2012 article from the International Journal of Microbiology titled Bacteriophages and Their Role in Food Safety, it is stated that, towards a food safety perspective, phages are possibly one of the most harmless antibacterial approaches available, and that various phage products have already been approved by the U.S. Food and Drug Administration and the U.S. Department of Agriculture for use in the agro-food industry. Like antibiotics, bacteriophages prove quite effective against bacteria. Phages are bactericidal, killing bacteria entirely by rupturing their cell walls and membranes. This is in contrast with bacteriostatic antibiotics, which only inhibit bacterial growth. Phages are not antibiotics, operating through entirely different mechanisms. Particularly, in a 2015 article from the journal Antimicrobial Agents and Chemotherapy, phages were shown to be capable of killing the bacterium Acinetobacter baumannii, a drug-resistant pathogen that has become increasingly prevalent in hospitals and that especially affects immunocompromised individuals. In a 2017 journal article titled Phage Therapy, an Alternative to Antibiotics in the Age of Multi-Drug Resistance, it is mentioned that bacteriophages are capable of penetrating through biofilms that antibiotics typically cannot, biofilms that encase many vital organs and that bacteria thrive in. Bacteriophages have more extensive capabilities than antibiotics. In particular, a 2016 journal article titled Genetically Engineered Phages, a review of advances over the last decade, details the various capabilities of bacteriophages. Bacteriophages can be genetically engineered in various ways to further combat antibiotic-resistant infections, even as a means of bacterial detection and diagnostics. Similarly, in a 2007 journal article titled Targeted Drug-Carrying Bacteriophages as Antibacterial Nanomedicines, it was mentioned that bacteriophages can be synthetically altered to be used as delivery mechanisms for conventional antibiotics, bypassing typical resistance mechanisms in a display of combination therapy. Unlike most novel antibiotics, bacteriophages are applicably cost-effective. In a 2019 journal article titled Phage Therapy with a Focus on the Human Microbiota, it is mentioned that bacteriophages have a relatively low discovery and production cost. This is largely due to the ubiquitous and proliferative nature of phages as environmental viruses. Phages are enormously diverse, providing a large variety of effective approaches against bacterial infections and antibiotic resistance. This lowers the aforementioned discovery costs that commonly plagues the production of novel antibiotics. The specificity and diversity of bacteriophages allow them to be added together in a phage cocktail to target multiple bacteria with a broader killing spectrum. This reaches the extent of traditional broad-spectrum antibiotics. The further versatility of application makes phages an even more viable antibacterial candidate, as they can be administered in various forms according to unique circumstantial requirements. This is similar to that of traditional antibiotics. Overall, bacteriophages demonstrate great potential regarding safety, efficacy, capability, and value as based upon various comprehensive journal articles and reports. And as the issue of antibiotic resistance becomes more and more prominent, further scientific research into antibiotic alternatives like bacteriophages is expected, and this superbug may very well disappear. Thank you.
Woo! Awesome. Hey, there we go, recording. And again, just take a deep breath. You're going to do absolutely fantastic. You got this. The floor is yours, Will, whenever you're ready.
Hello, everyone. My name is Will Verdon, and today I will be addressing a problem that affects millions over the United States and the world. Here I have a bottle of ibuprofen. If I was in front of you face to face, I would allow everyone to take a look, but due to circumstances, I'm not allowed to, so I'll show you through a screen. Now, what if I told you 2.8 million people in the United States were infected annually from overusing antibiotics such as these, shown in the PowerPoint, to as simple as ibuprofen? Also, what if I told you 35,000 people die in the United States per year from something most people have never heard of? Healthcare is falling apart. Recently, the coronavirus has had a sudden breakout all over the United States. There's not yet been a medication found to cure the disease. The question that is starting to be asked the most is, how can we save healthcare? There has been extensive research put in, but they have only come up with medications that somewhat work. Part of the reason for this is antibiotic resistance. Antibiotic resistance occurs when bacteria changes its response to the medicines being used, typically overusing medicines. Antibiotic resistance is being affected majorly all over the world. Not only is it affecting the people who can afford the antibiotics, but it is affecting the people who can only afford the cheaper antibiotics and have to use the same ones over and over again. There are many issues that have not been yet focused on to the extent they need to be. Millions of people are infected and thousands of people die annually to antibiotic resistance. This day and time, many people do not know why it is so hard to get over an illness. It can start from taking antibiotics when you're not sick. Most people do not know the effects that overusing antibiotics can have on their body. It can lead to antibiotic resistance. The reason this is happening to more people than it should is because they are not informed on the effects it can have on your body. Antibiotic resistance can change your cells. It can change the cells to not fight off some illnesses. According to the CDC, people do not follow the guidelines that are put out to try and slow down antibiotic resistance. Society today needs to look more into guidelines and try to stop this terrible thing from happening at a higher rate. For instance, one of the statements on the guidelines is, do not share any antibiotics with other people who think they need it. For most people, if they feel sick, they will go to their medicine cabinet and take some type of antibiotic. They ask other people to give them an antibiotic if they do not have the antibiotics they think they need. Most of the time, these people that are asked will give the person an antibiotic. In a survey put on by Healthline, 16% of parents say they give their child an antibiotic that was meant for an adult. 48% of adults said they held on to leftover antibiotics. 73% of the adults surveyed said they give an antibiotic to a sibling or a child or adult who they were not related to. Healthline suggests that it is best if, for whatever reason, do not give your antibiotics to other people. The CDC also said it is best to follow orders given to you from a doctor. When you go to the doctor's office, for the most part, you get prescribed a type of medication, mostly an antibiotic. This is not a good thing sometimes. According to Pew Trust, sometimes the doctor gives the patients the antibiotics for a comfort. Parents and children expect to be given a prescription when they walk in for a visit. The doctors know this, so they give them an antibiotic anyways. This is a leading cause to antibiotic resistance. Doctors also have more patients than the one that they are dealing with at the time. They quickly diagnose them with whatever the person may or may not have. The doctors should not do this because they know the effects of this better than most people do. Antibiotic resistance could start to form with the antibiotics they are giving out, and they know the effects it can have on your body. With all the problems leading to antibiotic resistance, society not knowing the effects, giving others antibiotics, and doctors prescribing unnecessary antibiotics, it can lead to many bad things. Antibiotic resistance can infect you, but it can also kill you. This is the reasoning for the stress behind statements about antibiotic resistance that get overlooked by society. They either do not know what it is or they do not think it is serious. Antibiotic resistance is serious, and people need to take this devastating infection more serious. I'll leave you with this. If you do not think this can kill you, you're most definitely wrong. Thank you.
Woo!